Okay, so today we are going to discuss about a new lecture. It is Neoplasia. Okay, so Neoplasia means neo means new, plasia means growth. Okay, and it was first defined by a person called Willis. Okay, which means abnormal mass of tissue. Okay, the growth of which exceeds and is uncoordinated with that of the normal tissue and persists in the same excessive manner after the cessation of the stimuli which evoke the change. This is the definition for neoplasia. Just I will explain the definition. For example, this is the lung. The lung tissue, and if there is a growth in the lung, this growth is not normal. Okay, it is abnormal growth. For example, if the person is cigarette smoker, if he is smoking, the smoking has created this growth. Okay, once the growth comes, if the person stops smoking, the growth will not stop. The growth will keep growing. Understand? So this is the definition of neoplasia. Okay, neoplasia means that new growth is is not a normal growth. Okay, but once it comes, the cause which made the growth to come, if you remove that, also the growth will not stop. Okay, once again I'm telling, once the growth comes, if the person stops smoking, the growth will not stop. Okay, so that is neoplasia. Neoplasia may be benign or malignant. If it is benign, it is localized. If it is benign, it is localized and it cannot spread. It cannot spread to any other site. It can be removed by surgery and the patient generally they survive. They will not die. So malignant is otherwise called as cancer, and the characteristic feature of malignancy is they invade and they will destroy the other structures, and the most characteristic feature of malignancy is metastasis. They will spread to the different distant organ. Okay, they will spread to the distant site. That is the characteristic feature of malignancy. For example, if the person having stomach cancer, okay, it will spread to the it will spread to the it can spread to the lung. Okay, so that is metastasis. That is metastasis. This is the characteristic feature of malignant tumor. So any tissue, whether it is benign or malignant, okay, any tumor, they will have two components. One is parenchymal and other one is mesenchymal. The parenchymal is otherwise called as epithelial component. Mesenchymal is called as stromal component. Okay, they are the connective tissues and parenchyma are the epithelium. Okay, so benign tumors, or now coming to the nomenclature of benign tumors. Okay, benign tumors, in the end we use the word voma. Okay, in the end we use the word voma. Okay, if it is parenchymal origin of tumor or it is epithelial origin of tumor, okay, we use the word voma in the end, and if it can produce gland or glandular pattern, we call it as adenoma. Adenoma means gland. Okay, if the tumor comes from the gland, we call it as adenoma. Okay, oma means benign tumor. Example, if the tumor forms renal tubules and gland, it is called renal adenoma. It is called renal adenoma. So once again I am telling, any epithelial tumor which comes as a benign, we use the word oma in the end, and if it forms gland, adenoma means gland plus oma, it is called adenoma. If it is comes from the kidney, it is called renal adenoma. If it comes from the, for example, in the stomach, it is called gastric adenoma. If it comes from the intestine, it is called intestinal adenoma. If it comes from the anal canal, it is called anal canal, or from the colon, it is called colonic adenoma. Understand? So papillomas means they, for example, it is the skin. Okay, have you heard of what? What? So a finger like projection in the skin. Okay, that is called what? What are the papillomas? Papillomas means they have a finger like projections, finger like projections, whether it can be microscopic or macroscopic, but it is benign. Okay, but it is benign because it has oma in the end. Okay, polyp also finger like projection in the mucosal surface. Okay, for example, in the stomach they can have, for example, this is the stomach, they can have finger like growth, finger like projections, that is called polyp. We don't have benign or malignant. Okay, it is called polyp. So once again I am telling, the benign tumors we nomenclate with the ending oma. If it is a parenchymal origin of tumor, if it is epithelial origin of tumor, and it forms gland, it is called adenoma. For example, it comes from the kidney, it is called renal adenoma. It comes from the intestine, it is called intestinal adenoma. Papilloma means they are benign tumor, but they have finger-like projection. You can see through eye or through microscope. But they should have finger-like projections, but they are benign. So they are called papilloma. Okay, now coming to the stromal origin of benign tumor. Stromal means mesenchymal. Origin of benign tumor. If the tumor arises from the fibrous tissue, it is called fibroma. Understand? In the end we have oma if it is benign. If it forms the cartilage, it is called chondroma. If it forms the bone, it is called osteoma. Okay. Now coming to the mixed origin of benign tumor. Mixed origin of benign tumor. Mixed means they have both epithelial and the stromal component. Epithelial, that is parenchymal, and the mesenchymal component, or epithelial and stromal component. Understand? I will take example of salivary gland. Okay, I will take example of salivary gland mixed tumor. So the name we give is pleomorphic adenoma. Adenoma means what? Epithelial tumor, and it is having cartilage and bone. So it is a mixed tumor. Another example is female breast. The female breast, the tumor is fibroadenoma. They contain fibroma plus adenoma. Understand? So it is a mixed tumor, fibroadenoma. Next, the tumor has oma in the end. Okay, they have oma in the end, but they are not benign. Okay, they are not benign. So they given the name wrongly. So that's why they call misnomers. For example, teratoma has oma in the end. The teratoma comes from the totipotential stem cell. The teratoma comes from totipotential stem cell. They have oma in the end, but they are not benign. They may be malignant also. Understand? They could be benign as well as they could be malignant. Okay. And there are other tumors, they have oma in the end, but they are not benign, they are malignant. Okay, they are malignant. Example: lymphoma, mesothelioma, melanoma, seminoma. They are highly malignant tumors. Understand? They are highly malignant tumors. So you should not always think oma means benign. Okay, there are some tumors wrongly they named, but they are malignant tumors. Okay, but still we follow the same name. Okay, but they are malignant tumors. At least you should know these four common tumor: lymphoma, mesothelioma, melanoma, and seminoma. Okay. Now coming to the tumor like condition called hamartoma. See, I cannot able to get the exact Arabic meaning. Hamartoma means it's a birth defect. Okay, it is a like a birth defect. For example, in a lung, if they have bone, in the lung if they have cartilage, lung if they have fat. So lung tissue should have only lung tissue, right? If they have bone or fat or cartilage, then it is a birth defect. Okay, that is a defect in the lung. So that is called hamartoma. So pulmonary means lung, chondroid means cartilage. If the lung has cartilage, it is called pulmonary chondroid hamartoma. Pulmonary chondroid hamartoma. I will show the picture, you will understand. See, this is teratoma. Understand? They have bone, they have hair. See, this is the lung tissue. This is the lung tissue. You are seeing, this is lung. Okay? But what you are seeing here, it is a cartilage mixed up with fat. Okay? Cartilage mixed up with fat. It is hamartoma. It is hamartoma. Okay, now coming to the nomenclature of malignant tumors. So, first, malignant epithelial tumor. If the malignant epithelial tumor forms glandular pattern, it is called adenocarcinoma. It is called adenocarcinoma. But if it is a malignant epithelial tumor, generally we will call it as a carcinoma. Understand? If it forms gland, adeno means gland. If it forms gland, it is called adenocarcinoma. For example, in the kidney, they form a cancer, epithelial cancer. It is called renal adenocarcinoma. Understand? If they form squamous cell, it is called squamous cell carcinoma. If they form squamous cell, it is called squamous cell carcinoma. Okay. So now coming to the malignant mesenchymal stromal tumors, it is called sarcoma. Okay. It is called sarcoma. If it comes from the fibrous tissue and it is malignant, it is called fibrosarcoma. If it is from the cartilage cells, chondrocytes, and it is malignant, it is called chondrosarcoma. If it is from the bone cells, if it is from the bone cells and it is malignant, it is malignant, it is osteosarcoma. So now coming to the characteristic features of neoplasm. Okay. So I am drawing some normal tissue here. This is a normal tissue. It is made up of cells. Okay. It is made up of some cells. Okay. And this is tumor. Okay. And this is tumor. You can see any difference between two? You can see any difference? You can't see any difference, right? So this is 100% resembling the normal, right? It is 100% resembling the normal. Okay. So differentiation means how much the tumor resemble the normal. Okay, that is differentiation. In this case, it is 100% same. Okay, it is well differentiated. Understand? So differentiation means how much the tumor cells resemble the normal cells in morphology and in function. Understand? So if it is 100% looking same in morphology and in function, it is well differentiated. If it is 50%, it is moderately differentiated. If it is 25%, it is poorly differentiated. Okay. If it is 0%, no similarity. Okay. It is no differentiation. It is no differentiation. Understand? Differentiation means, once again I am telling, differentiation means how much the tumor cells resemble the normal cell. If it is 100%, it is well differentiated. If it is 50%, it is moderately differentiated. If it is 25%, it is poorly differentiated. If it is 0, no differentiation. Understand? So benign tumor are always well differentiated. Benign tumor are always well differentiated. Anaplasia means no differentiation. Okay, anaplasia means no differentiation. But malignant tumors may be well differentiated, moderately differentiated, or poorly differentiated, or it could be anaplastic. It could be no differentiation. So this is the difference between benign and the malignant tumor in terms of differentiation and anaplasia. So once they become anaplastic, the cells will exhibit 4 features. First one is pleomorphism. Pleomorphism means variation in size and shape. See, normally if the cell divide, it looks like a parent cell. The daughter cells will look like a parent cell. If the cell is dividing, this cell will look like a parent cell. Okay, but if anaplastic cells are dividing, one will be small or one will be very large. This is variation in size and shape of the nucleus and the cell. It is called pleomorphism. Second feature is abnormal nuclear morphology. See, for example, normal cell has 1:4 or 1:6 nucleus cytoplasmic ratio. The cytoplasm will be 4 times like nucleus or 6 times like nucleus. But in the anaplastic cell, it will be like 1:1. Okay, it will be like 1:1. So the normal nucleus cytoplasmic ratio is shifted to 1:1 in anaplastic cell. Okay, so normally it will be like this. Okay, 1:4 or 1:6. In the anaplastic cells, it will be becoming like more nucleus, 1:1. It is called abnormal nuclear morphology. There is a shifting of nucleus cytoplasmic ratio from 1:4 or 1:6 to 1:1. Okay, mitosis means cell division, right? If the anaplastic cells divide, they divide into 3, 4, 5. It is called abnormal cell division. Okay, it is called abnormal cell division. Loss of polarity means actually loss in the direction. Okay, I will give you an example. Okay, oral mucosa is lined by what type of epithelium? Non-keratinizing stratified squamous epithelium. So they have a basal layer and they have a spinosome layer and they have what? Granulosa cells. Okay, granulosum layer, stratum granulosum, and they will mature and they form the stratum corneum. Okay, The basal layer is made up of basal cells. Basal layer is made up of basal cells. Okay. If the basal cell should be in the basal side, basal cells should be in the basal layer. If the basal cell goes to the stratum spinosum, it is loss of direction. Understand? It is loss of direction, that is called loss of polarity. Loss of polarity. So this is the characteristic feature of anaplastic cell. So loss of polarity is the characteristic feature of anaplastic cell. Once again I am concluding. The morphological changes in anaplasia, 4, very important. One is pleomorphism. There is variation in size and shape of the nucleus and cell. Second is abnormal nuclear morphology. The nucleus becoming big. That is the change from nucleus cytoplasmic ratio 1:4 to 1:1. Then abnormal cell division. They divide and they form 3, 4, 5 cells like that. They will not divide into 2 cells. They divide into more number of cells. And loss of polarity means they will lose their direction. For example, the basal cells will not be in basal cells. They will go to the superficial area. Okay, that is called loss of polarity. So now coming to the dysplasia. Dysplasia means disordered growth. Dysplasia means disordered growth. So dysplasia is encountered mostly in the epithelium. Okay. So now I am taking example as a cervix. You all know cervix. Cervix, where it is. So we have a uterus. The mouth of the uterus is called cervix. Okay. And the cervix has 2 parts, ecto and endo, outside and inside. Outside ectocervix is lined by stratified squamous epithelium. Understand? Stratified squamous epithelium. They have 3 layers: basal layer, intermediate layer, and superficial layer. So you all know basal cells should be in the basal layer, right? If the basal cells divide more, because the basal cells have a capacity to divide. Okay, if the basal cells divide more, now you see the basal cells are increased. This is the basal cell. Okay, this is the basal cell. If you see in this picture, the basal cells are increased. So that is called dysplasia. So if it is in the lower 1/3, it is called mild dysplasia. If you see here, it is increased more. It is 2/3. It is called moderate dysplasia. If it is increased full, it is called severe dysplasia. It is nearly full, 3/3 full. It is increased, and this whole cell sits on the basement membrane, right? They all sit on the basement membrane. If they break the basement membrane and they invade, okay, then they will become cancer. So they will start with mild dysplasia, then they will become moderate dysplasia, then they will become severe dysplasia, and they will become carcinoma in situ. And once they break the basement membrane, then they will become cancer. Okay, then they will become carcinoma. Okay. Now carcinoma in situ. Carcinoma in situ means the cancer is formed, but it is within the basement membrane. Understand? They are confined to the basement membrane. Okay. It is called pre-invasive neoplasm. It is called pre-invasive neoplasm. Understand? They are cancer is formed, but the cells becoming cancer, but they are not invading. They are not infiltrating. They are within the basement membrane. Once they break the basement membrane, then they will become cancer. Once they break the basement membrane, they will become cancer. So the breaking of basement membrane is very important. Once they break the basement membrane, they will become cancer. So now coming to the another character of neoplasm. Okay. So invasion. Understand? See, if this is the benign tumor, these are the cells of the benign tumor. Okay. These are the cells of the benign tumor. If the benign tumor is growing, okay, they grow like a mass and the cells will stick together. Okay. See, they are growing like a mass expansion. But if it is a cancerous cell, okay, if they are growing, they will not attach to one another. Okay. So just you can compare the present day Umma. Okay. So we are not sticking together. Okay. We are scattered. So likewise these cancer cells are. The cancer cells, they will not attach together. Okay. They will go here and there. And the benign tumor cells, they attach together, they grow as a mass. Okay. So that is called cohesive joining together. Expansile mass. As a mass they expand. When they are expanding, this is the thyroid tissue. Okay. This is the thyroid tissue and you can see a benign tumor. You can put a neat circle here, right? It is well circumscribed and they have a white, this white is called fibrous capsule. It is called fibrous capsule. They form a capsule. Okay. So because the tumor cells grow as a mass. Okay. This is the characteristic feature of benign tumor. Just it is exactly opposite in the malignant tumor. You see the malignant tumor, I cannot put a clear circle, okay, because it is spreading. The white is the tumor. It is a breast cancer. Okay, see, it is spreading to the neighboring tissue. Okay, this is the characteristic feature of malignant tumor. They are infiltrative, they invade and they will destruct the surrounding tissue. They destroy the surrounding tissue and they will develop metastasis. So metastasis is the characteristic feature of malignant tumor. They will go to the different organ. Okay. For example, if they are having a breast cancer, it will go to the lung, it will go to the brain, it will go to the bone. So that is metastasis. Okay. So now coming to the in detail of metastasis. In detail of metastasis. Okay. See, I give some example, you will understand more. So now the guy has a lung cancer. Okay. This is the primary cancer, right? This is called primary lung cancer. Understand? What happens? It spreads. What happens? It spreads. For example, it enters the blood vessel. The cancer cells enters the blood vessel and the blood vessel is going to the brain. The blood vessel is going to the brain. Now cancer is in the blood and it is entering the brain and it is depositing there. Okay, once it get deposited, it grow there. Okay, this is called metastatic lung cancer. Understand? The lung cancer metastasized into the brain. It is called metastatic lung cancer. Okay. You all know thyroid. So the the person is having thyroid cancer, okay, and if it goes to the lung, it spreads there, right? Go to the lung, it spreads there. So this is primary thyroid cancer, right? It is primary thyroid cancer. What is this is called as? Metastatic thyroid cancer. Understand? So metastasis means the tumor implants, that is the tumor, okay, discontinue, okay, with the primary tumor and it enters to the other organ, okay. So it is the characteristic feature of malignant tumor. It is the characteristic feature of malignant tumor. Okay, there are two malignant tumors that will not go for metastasis. Okay, one is glioma, other one is basal cell carcinoma. Glioma are the brain tumors. Glioma and basal cell carcinoma of the skin, they will rarely metastasis. Okay, rarely means actually we never seen a case of metastasis in the basal cell carcinoma and glioma. Okay, brain tumor. So there are three ways of cancer spreading. So first is it can spread through the blood vessel. Okay, it is called hematogenous spread. Most of the sarcomas, they spread like that. And if they spread through the lymphatics, it is most of the carcinomas spread like that. And for example, if there is a stomach cancer, okay, what happens? The stomach cancer infiltrate the stomach wall and the cancer cells drop in the abdominal cavity, okay, and it can spread to the all organ of the abdominal cavity. That is called direct seeding of body cavities. So you should memorize this name. It is called as pseudomyxoma peritoneum. It is called as pseudomyxoma peritoneum. Take 5 minutes rest and come. Take 5 minutes break. Okay. So now we are going to discuss about how the cancer forms. Okay. Now we are going to discuss about how the cancer forms. Okay, you all know three types of cell, right? One is cell keep on dividing. Okay, that is dividing cells. There are some cells in our body, they don't divide, they normally take rest. But when it is needed, they will divide. Example? Any example? Mashallah, liver. Okay, they will be normally rest. When it is needed, they will divide. Okay, so I am going to take example of a resting cell. Now this cell is resting. Okay, so what makes this cell to be in rest? Okay, when the cell is at rest, it is at the G0 of the cell cycle. Okay, G0 we call it as. Okay, what makes them to be in rest? Because there are some genes in that cell that inhibit them to grow. Understand? They inhibit them to grow. Okay, that genes are called growth inhibiting gene. Okay, so if a signal comes to the cell, okay, then they will tell the cell to grow. Okay, that signal is called growth signal. Okay, that signal is called growth signal. Okay, when the growth signal comes, they will do two things. They will make this inactive and they will activate growth promoting gene. Okay, so I am taking example of the resting cell. This is the cell at rest. Okay, this is the cell at rest. Why the cell is at rest? Because of the growth inhibiting gene. There are some gene in that cell, they are not allowing them to grow. That's why the cell is at rest. So when the cell is at rest, it is called G0. Okay, it is called G0. It is called G0. When the growth signal comes, two things happen. One is they stop this. They stop the growth inhibiting gene and they activate the growth promoting gene. They push the cell from the G0 to G1. Understand? Then they will go to yes. Then they will go to G2. Then they will go for M. Then they will divide. Then they will divide. Understand? It is a cell cycle. Understand? It is a cell cycle. Once again I am telling, when the cell is at rest, the growth inhibiting gene plays a role and they will not allow them to grow. When the signal comes, the growth inhibiting gene will become inactive. Okay, and the growth promoting gene becomes active. They will push the cell from G0 to G1. Okay, G0 to G1. Then they will go to the next level. S. S means DNA synthesis. DNA synthesis. Okay, so when DNA is synthesizing, which means DNA is making copy. Okay, they are making into two DNA. When DNA is copying, so there should be someone to check the DNA whether it is correctly copied or not. Understand? So we have a checkpoint here. We have a checkpoint here to check the DNA. Then after the synthesis of the DNA, the cell will move to the G2. Once they move to the G2, they are ready to divide now. Okay, so when they are ready to divide, again we have a checkpoint here to check it again. Understand? Check the DNA. Okay, so after two checking, then they will divide. So this is called checkpoint 1 and this is called checkpoint 2. Okay, checkpoint 1 is in between G1 and S and checkpoint 2 is in between G2 and M. Okay, So this checkpoint, there are some genes in our cell, so they will check whether the DNA is good or bad. Okay, so such genes are called regulatory genes. Such genes are called regulatory genes. Okay, if they are checking, if the DNA is not good, there is some problem in the DNA, they will repair the DNA. So such genes are called DNA repair genes. Okay, DNA repair genes. If they can't able to repair, then they will make the cell to go for apoptosis. They will make the cell to go for apoptosis. So we have a gene for apoptosis. Okay, I am going to conclude now. The cell is at rest. Okay, when the cell is at rest, why the cell is at rest? Because of the growth inhibiting gene. Okay, growth inhibiting gene. So growth inhibiting genes are called as tumor suppressor gene, example P16 and P53. There are many examples, just I am telling only two examples because it is relevant today's topic. You should memorize it, P16 and P53. So growth signal comes, when the growth signal comes, the growth inhibitor genes will become inactive and the growth promoter genes become active. When they become active, they push the cell from G0 to G1. From there G1 to GS. In between that we have a checkpoint 1. Then the DNA is synthesized. Then they will move to G2. Then they will go to M. In between G2 and M we have checkpoint 2. During this checkpoint we have a regulatory genes, they will check. Okay, so when they are checking, when the DNA is repaired, they will repair. That genes are called DNA repair genes, example P53. And if can't able to repair, they will tell the cell to die. That genes are called apoptic gene, again P53. Okay, so the growth promoting genes are called proto-oncogene cyclin. Okay, so the growth promoting genes will become active after the signal. Understand? After the signal. If there is no signal, there will not be activation of the growth promoting gene. Okay, if the growth promoting gene keep on getting active without signal, okay, that is dangerous. Okay, the growth promoting gene will become active after the growth signal. After the growth signal, for example, if you cut the liver, then only the liver should grow. Understand? The liver should not grow every time. Okay, the liver should be at the resting state. Understand? So that is the cell cycle. These are the genes involved in the cell cycle. You carefully see the P53, it is involved in three areas. Okay, they inhibit the growth, they check the DNA. If it is repair, they will repair the DNA, and if they can't repair the DNA, they will make them to go for apoptosis. So P53 is called as molecular policeman. Molecular policeman, because it is checking, it is verifying, and it is allowing. If they can't do the things good, they will tell them to die. So it is called as molecular policeman. It is called as molecular policeman. Understand? So the G0 is the resting cell, and why it is resting? Because of the growth inhibiting gene. When the signal comes, the growth inhibiting gene become inactive, then the growth promoting gene gets active. The growth promoting gene is cyclin, proto-oncogene. Growth promoting gene is cyclin. Then they will push the cell from G1 to S, then S to G2, then M. Then they will divide. While they are pushing from the G1 to S, we have a checkpoint, and from G2 to M, we have a checkpoint. In the checkpoint, they will check whether the DNA is good or bad. If it is bad, then they will repair it. Then the DNA repair gene comes. If they can't able to repair, then they will tell them to die. Okay, they will not allow the bad DNA to come. They will tell them to die. So the major role is done by the P53. So it is called as molecular policeman. If P53 is damaged, the gene P53 is gone for mutation, what will happen? They cannot inhibit the growth, they cannot check the DNA, they cannot make the cell to die. So automatically they will become cancerous. They will become cancerous. So all the cancer cells are monoclonal. Okay, all the cancer cells are monoclonal. Okay, now let us define the proto-oncogene. Proto-oncogene are the normal cellular gene that is needed for cell proliferation. So the proto-oncogene is a growth promoting gene that is needed for normal cell growth. Okay, that is needed for normal cell growth, which means after growth signal they will become active. Understand? The cell is at rest. When the growth signal comes, this proto-oncogene will become active. But oncogenes are the mutated version of proto-oncogene. Understand? They don't recover. Without requirement of the growth promoting signal, they will divide. Okay? They don't need growth signal. Okay? That is cancer genes. Understand? They are called cancer genes, oncogenes. Understand? So, oncogenes that promote uncontrolled, okay, uncontrolled proliferation of cells, uncontrolled proliferation of cells, okay, unregulated, they cannot regulate it. So that is the problem in the oncogene. Okay, now coming to the molecular basis of metastasis. So you all know metastasis, right? It goes to the distant site, okay, from the primary tumor. So when the malignancy, if you ask anything like characteristic feature of malignancy or hallmark of malignancy, the most important in malignancy, it is metastasis. Understand? Going for metastasis is the characteristic feature of malignancy. So how the cancer cells travel? Okay. So first they have to get detached, get separated, get detached. So see, this is the cancer. So they are getting detached and they are going to the connective tissue. They are going to the connective tissue. Okay, they are going to the connective tissue and they are destroying the connective tissue. Then only they can move. They have to destroy the connective tissue. Then only they can move. After destroying the connective tissue, they are moving and they are entering the blood. When they enter the blood, they will land in another new. Novel means new. Okay, new connective tissue. See, they are entering a new connective tissue here. So then they will migrate. Then there will be a migration of tumor cell. So metastasis contains four mechanisms. First they have to get separated. Then they have to go to the connective tissue. Then they have to attach to the new connective tissue. Then they will migrate. So these are the four processes in metastasis. So remember, metastasis is there. I don't want to think of anything. I will call it as a cancer. Okay, I will call it as a cancer. Okay, now let us take an example of oral cancer. You will understand everything. So cancer is a multi-step process. Okay, formation of cancer is a multi-step process. It is a multi-step. Carcinogenesis means formation of cancer, formation of carcinoma. It is a multi-step process. Okay, so first there should be some risk factor. For example, if the person is using tobacco or he is infected with human papilloma virus 16 and 18, okay, then they will go for certain changes like leukoplakia and erythroplakia. Leukoplakia means white patch, erythroplakia means red patch. They go for changes like this. From there the cancer comes. I'll show the picture, you will understand. And if they drink alcohol or any other irritation in the mouth, that will increase the chance for getting the cancer. Okay, this is the normal mucosa. This is the normal mucosa. The normal mucosa is lined by what type of epithelium? What type of epithelium? It is a non-keratinizing stratified squamous epithelium. If the person is starting smoking here, if the person starts smoking here, then it will become hyperplasia. and keratinization. See, they are becoming like a skin-like epithelium. The mutation happening here is P16. The mutation happening here is P16. Then they will become dysplastic. Then they will become dysplastic. Their mutation happening here is P53. When the mutation happens in the cyclin D, then they will become cancer. Then they will become cancer. So this is a multi-step process. If the person stops here, okay, then it will come back to normal. Chance for coming back to normal is more. If he is not continuing, then he will end up with cancer. Okay. So once the P16 gene, P16 is a growth inhibitor gene. P16 is a growth inhibitor gene. If it gets mutated, they will go for hyperplasia. They will go for hyperplasia. If P53, you all know P53 inhibit growth, repair the DNA, and they induce apoptosis. Okay, they induce three function. So if it gets mutated, they will go for dysplasia. If the third gene, you all know cyclin gene, it promotes growth. It promotes growth. If it goes for mutation, they cannot be controlled. They go for complete cell division. So it results in cancer. It results in cancer. So now we are going to discuss about the things which produce cancer. Okay, what are the things can cause cancer? What are the things can damage the gene? Okay, that things are called, the substances are called as carcinogens. Okay, so carcinogens may be chemical, or it may be radiation, or it may be microbes. Now let's discuss about chemical carcinogen. It can be directly acting on the cell, or it is indirectly act on the cell, which means in the body it is converted into active. Okay, there are some substances in the body like polycyclic hydrocarbons, aflatoxin B, they gets converted into carcinogen in the body. Okay, so let us discuss two specific carcinogen which is very common. Benzopyrene. If you light the cigarette, okay, if you light the cigarette, the tobacco forms a chemical substance called benzopyrene, highly carcinogenic, highly carcinogenic. And if the food and nuts get infected with fungus, aspergillus, okay, I am discussing only two examples, very important. If it gets infected with aspergillus, then they release a chemical substance called aflatoxin. It's a toxin. It is a toxic substance, aflatoxin, that will lead to liver cancer, hepatocellular carcinoma. That leads to hepatocellular carcinoma. So this is acrylamide, very, very dangerous substance. If you take the food, normally it is not in the food. If you burn the food, if you roast the food to high temperature, like in Albert, McDonald's and KFC, okay, and okay, weekly, I mean yearly once or twice if you eat, it's not a problem. Okay, if you habit of eating weekly twice, it is a big problem. Understand? Because because they have to deliver it very fast. Okay, they have to keep it in a heavy temperature. Just they do 2-3 dip. If you don't, if you have a friend, if you enter the kitchen, you can see they just do 2-3 dips. It gets roasted. Okay, so if you take that food, any food, to a high temperature, the substance formed in the food is acrylamide. Okay, the substance formed in the food is acrylamide. It is highly cancerous. Even in the, it is like, it's very difficult to go against the McDonald's, even in United States. Okay, except only one state can put a rule on McDonald's that we have to put in their food product their acrylamide, in California. Okay, rest of the other states, they don't bother. Food regularities are more strong in California. Okay, and then the other states. Okay, so slowly researchers are putting their effort to on force on McDonald's and KFC to put the acrylamide, like for example, that in the cigarette packet, they say cigarette kills or tobacco kills. Okay, but still we smoke. Okay, that's a funny thing. Okay, so like that they are want to put some warning in the food. So inshallah it will come soon. So the substance which is formed is called acrylamide. Okay. Now coming to the radiation. Okay, you all know about nuclear radiation. Okay, you all know about Hiroshima, Nagasaki, and recent tsunami, the Japan, Fukushima. So these are all nuclear radiations that will very dangerous, that will produce all types of cancer. Okay, because radiation directly damage the DNA, directly damage the nucleus. Understand? Two things can happen. Whether the cell can go for apoptosis or the cell can go for mutation and they will keep on dividing. Okay, two things can happen in radiation. Okay, so sometimes we use the radiation for treatment. In cancer patient, we use the radiation for treatment. For example, a person got oral cancer. Okay, in oral cancer or tongue cancer, we give head and neck radiation. We give head and neck radiation. When we are giving head and neck radiation, there is a thyroid gland. It is very sensitive gland. Thyroid gland. They get affected and they will become cancerous. Okay, it is very sad part. They produce papillary thyroid cancer. That's why they will now the recent advancement, they are protecting the thyroid while giving treatment. Okay, so now they get papillary thyroid cancer. Now coming to the ultraviolet radiation that can produce all types of skin cancer, melanoma, squamous cell carcinoma, basal cell carcinomas. Okay, there are three types of ultraviolet radiation: UVA, B, C. UVA indirectly cause cancer by increasing the free radical. UVB and UVC has direct effect on the DNA. So UVA increase the free radical. That free radical will affect the DNA. Okay, that is the difference. So now coming to the viruses and bacteria. So we divide the viruses into RNA and DNA virus. Let us discuss more about oncogenic DNA virus. There are three viruses which commonly produce cancer. One is human papilloma virus. It is very important because it is one of the most important virus which produce cancer in the cervix, in the female, in the anus and in the oral. It is sexually transmitted disease basically. It is sexually transmitted disease if they do immoral sexual behavior. The most important type is 16 and 18. Most important type is 16 and 18 and it is the most commonest cause for cancer in women in most of the countries except Saudi Arabia. Okay, because alhamdulillah we are protected by Sharia here. Okay, so this is the most important fact. Okay, most of the countries the highest leading cancer in women is breast, second is cervical cancer. In Saudi it is not like that. First is breast in Saudi, but actually it is not in even in top 10 cervical cancer is not there. In the, last time I looked how many cases identified in Saudi, it is only 122 cases. Okay, whereas in other countries 30% of the woman cancer is due to human papilloma virus. Okay, so you think of fahisha there. Okay, how much fahisha? So that is the reason. Understand? So human papilloma virus, you should not forget. Now they have a vaccine for it for 16 and 18. We have a vaccine for human papilloma 16 and 18. Okay, and there is another virus called Epstein-Barr virus. Okay, Epstein-Barr virus. If you take in this hall, even 50% will be having this virus. But we are not getting cancer because alhamdulillah we have good immune system. Okay, if the immune system goes down, then this virus will produce their cancerous. Okay, that is lymphoma and nasopharyngeal carcinoma. And you all know about this hepatitis B and C, right? It is again spreads through blood, through sexual means, and we have vaccine for hepatitis B. Okay, we have vaccines for hepatitis B. C, it is on trial, and one of the scientists told it is failure, but they are trying to bring vaccine for C also, but hepatitis B vaccine is available. So it produces hepatocellular carcinoma. It produces hepatocellular carcinoma. So now coming to the bacteria, and it is the Helicobacter pylori. They produce gastric adenocarcinoma, stomach cancer, and malt lymphoma in the stomach. Okay, we have a very good drug for this bacteria. Only thing we should know, we are infected by this bacteria and take that drug, it will kill all the bacteria. Okay, the bacteria name is Helicobacter pylori. So now it's about Steve Jobs. Okay, you all know about him, right? So this is the stage when he gave presentation for iPhone. Okay, when he launched the iPhone. This is iPhone 4. Okay, so what happened to him from iPhone launch to next iPhone 4? Because he has been affected by pancreatic cancer. Okay, so this is the last presentation, I think. Okay, so really I love his presentation. Okay, the way he presents. Okay, uh, what happened to him is the cancer made him to lose all his fat. Okay, or his fat, and loss of body fat, and they become very lean. They become very lean, and they become very weak, anorexic, and they become anemic. This whole condition is called cachexia. Okay, cachexia. So you'll never forget it if you remember this picture. Okay, so what happens in a cancer patient? The cancer cells secrete TNF. The TNF will make them to not to feel hunger. Okay, their appetite is suppressed. They will not feel hunger, and they inhibit the fatty acid coming out of lipoprotein, so they don't get fat. Okay, so they will become like this because of this TNF. Understand? So when the cancer patient becoming anorexic, okay, or they become cachexic, it is nearly end stage. Okay, most of the end stage 4 patient will become like this. Next is paraneoplastic syndrome. It is very simple. We have cancer cells. These cancer cells release hormone. Normally hormones are released by the endocrine glands. Okay, but if the cancer cells produce hormone, that hormone will produce the effect. That is called paraneoplastic syndrome. Okay, I am going to give only few examples. If the cancer cells release parathyroid hormone, that will make hypercalcemia. That will increase the serum calcium level. That will increase the serum calcium level. What type of calcification they will get? What type of calcification they will get? What type of calcification they will get? Metastatic calcification. Okay, mashallah. You really understand? Why? Because increased calcium is the problem. They will go and deposit in the normal tissue. Understand? It is metastatic calcification they will get. This is one of the reasons for hypercalcemia. It is one of the reasons for hypercalcemia. If ACTH is increased, adrenocorticotrophin hormone is increased, they will get Cushing syndrome. They will get Cushing syndrome. Understand? Inshallah, we will discuss more about this syndromes and all in the endocrine module. Now, understand this hormone increase will produce Cushing syndrome. They will become very huge. Okay, they will become very huge. Now, coming to the grading of cancer, this all you guys know now. If the cancer cell is resembling the normal cell, it is well differentiated. It is well differentiated. If the cancer cell is resembling the normal tissue, it is 50% only resembling, it is moderately differentiated. If it is 25%, it is poorly differentiated. No resemblance, it is anaplastic. Anaplastic cells are very, very dangerous. Okay, they are very aggressive. Anaplastic malignant tumors are very aggressive, and the patient usually will die in months, in few months. Okay, so they have a very bad prognosis. Understand? So that's why grading is important. Okay, so we have to tell the patient, and we are not allowed to fix the date for them. Okay, but we have to tell the patient that his prognosis won't be good as expected. Okay, it will be, usually we will counsel the patient because he has to know what is going on him. Okay, next it is very important, staging usually we stage from 0 to 1 2 3 4. Okay, depend upon tumor size, lymph node in Arabic, lymph node involvement and metastasis. Okay, it depends upon these three things. We stage them into stage 1, stage 2, stage 3 or stage 4. Understand? The stage 3 and stage 4 patient will have very bad prognosis. Prognosis. If they have metastasis, automatically all cancerous tumor is stage 4. If they have metastasis, it is stage 4. Okay, so if the person is having breast cancer, it is 1 centimeter size, but it metastases to the brain or bone or the lung, it is stage 4, whatever the size may be. Even it may be 0.5 centimeter, it metastasis, it is stage 4. Understand? Okay, why I am telling is, there is a one tumor in the breast cancer. There is a different types of breast cancer. There is specifically one breast cancer. It will be very small. Okay, it will be like 0.5 centimeter, but it is very dangerous. It kills the patient very soon. Okay, because the cells keep on spreading. Okay. Okay, now this is the last slide. Please concentrate. Very important because we will be using in the lab. Okay, it is more or like paraneoplastic syndrome. The tumor cells, the cancer cells secrete some protein, enzyme or hormone that we will check in the lab. Okay, for example, if a person is having prostatic adenocarcinoma, prostate cancer, you all know prostate cancer. What we do is, we will check a protein in his body, in his blood, prostate specific antigen, PSA. Okay, it will be more. Okay, so nowadays in the prostate cancer screening, they check PSA level. The problem is, if the PSA level is more, it is not definite, it is not 100% cancer. It may be hyperplasia also. Understand? So it is not diagnostic, it is just used as a screening, but we have to confirm it. Understand? We have to confirm it. But in other situation, it is very useful. For example, ovarian cancer. I'll give you some real-time case. So we used to have many ovarian cancer. Ovarian cancer comes in male, right? No. Sure, right? It comes in female. Understand? It comes in female because they only have ovary. So if it comes in the female ovarian cancer, we will check a protein called CA125. It will be elevated. Okay. For example, if it is 1000, okay, I am going to start a treatment. After treatment, it should reduce. Okay. After treatment, it should reduce. If it is reduced to 10, okay, then I discharged her. Every 6 months, we will ask her to come and we will check the CA125. Understand? We will check the CA125. In the second follow-up, in the second time she is coming, it is increased to 500, which means recurrence has happened. Okay, then we will do some investigation where it is going, then we will start treating. Okay, so it is used as a therapeutic indicator, prognostic indicator. Understand? It is used to know how our drug acts. Okay, if she is having 1000 and I am giving the drug, it should come down. Understand? It is therapeutic indicator. Okay, if it is not coming down, my drug is not acting. Understand? My drug is not acting. Understand? So this is used in these conditions as a therapeutic and prognostic indicator. You should know at least there are many tumor markers. You should know at least these 4. Prostatic carcinoma, PSA is increased. In ovarian cancer, CA125 is increased. In hepatocellular cancer, the alpha fetoprotein is increased. In colon cancer, in pancreas or stomach or breast, CA is carcinoembryonic antigen is increased. Okay.